So without further ado, I want to introduce today Michael Newton as our moderator for this session. Michael is the Chief of Police at Iowa State University Department of Public Safety. And he's also, besides being a longtime friend of NAMI Iowa, he is the president of the NAMI Iowa Board of Directors. So again, if you have questions during the session today, or when we switch to Q&A from the audience, please do put those in the Q&A box. And again, if you have technical issues, put those in the chat box and our producer can help today. Thank you very much, and I'm going to turn it over to Michael.
All right, thank you, Heather. Well, I'm excited about this panel that we have here today. I'm looking forward to hearing everything that they have to talk about, looking at different models of how we respond to our current mental health crisis and situations that we have. So what I'd like to do today is start with having the panelists introduce themselves, and I'll just go by the list I have. Let's go ahead and start with Tim.
Thanks, Michael. My name's Tim Black. I head up consulting and outreach for Whitebird Clinic, which operates the CAHOOTS program. Just very briefly, I'm also a former CAHOOTS first responder and program administrator.
Excellent, welcome. Now, Ellen.
I am a part of Let's Talk, which came out of AMOS, which is a local organizing group. And I'm also a retired school social worker, so that fit nicely into my Let's Talk program, which I'll tell you more about later.
All right, thank you. Welcome. Amy.
Hi, I'm Reverend Amy Petrie Shaw, and I am the senior minister at First Unitarian Church here in Des Moines. And I am also a former nurse, a nurse exec who worked a lot with the mental health community. And I also have adoptive children who have required profound mental health services throughout their lives.
Welcome, thank you. Teresa.
My name is Teresa Zilk. I am the owner of Teresa Zilk Creative Consulting, and it's basically a training with storytelling. But what really drew me to the panel, wanting to be a part of it, was that for the last 3 years, my family and I have kind of had a journey through the mental health system in Iowa. And that kind of galvanized me to be more involved and interested in advocating for more mental health services.
Thank you, welcome. Iowa has a long ways to go in this journey, and together we can help, fix and change the scope of the mental health picture in the state that we have. But everyone wants to hear from the panelists. So I'm going to do these first. I have a series of questions. The first 3 are going to be for all the panelists, and I have some that are for specific panelists. But the first one I want to start with is, how did we get here? We don't call the police when someone has a heart attack. So why do we call for mental health crisis? How did this culturally evolve? And I'll take anyone who wants to start first with that.
And I can take a stab at this. One of the things we had found out was that if you stepped back 100, 150 years, when things went wrong, who did you call? Well, you called the police, because once you get back before the internet age, before the digital age, you didn't always know who to call. So the police were the friendly catch-all who could tell you where to go, or if they didn't know, just pick an answer and send you that way.
Another thing that's really important to bring up is that, you know, we need to understand maybe what some of the intentions might be behind, you know, reaching out to public safety when we see these crises that are emerging in a community. You know, so often, you know, in my conversations with other communities, we confront this lack of real understanding about what it is that somebody's experiencing. And when we see that thing that looks different than what we're used to, you know, then that something that conflicts with our, you know, kind of personal perceptions, that lack of understanding can be, you know, can trigger fear. And when we have that fear response, we assume that because we feel fearful, there's something that is threatening us, and that we want to reach out, you know, to find that that protection and enforcement. And so, you know, I think that there's a significant component of this work that really has to do a lot with white fragility, and really, you know, being fearful of these things that challenge our conceptions around what our neighborhoods, what our communities look like, and when we're forced to confront, you know, the realities of an individual's experience, you know, when it so contrasts, you know, with what we, you know, might be going through day to day.
Thank you. Anyone else with a thought here?
Well, one of my thoughts on it was, you know, there was a great closing of mental health facilities back in the 80s, and so many social programs were cut, but mental health truly took a hit. There were, you know, less resources available for people, less resources available to communities, particularly communities of color that were impacted by this.
And for whatever reason, I think we think of mental health issues as somehow being different from physical health issues. You wouldn't wait a minute to call the hospital about a physical issue, but growing up, I never thought of mental health issues that way.
Yeah, in my work before coming to Iowa, I was actually in Wisconsin, and I was on the board of directors for NAMI Wisconsin as well before coming here. And there's a really good, if anyone wants to take a look, Milwaukee Journal Sentinel did a piece. It's a lot on the mental health system in Wisconsin, but it talks about how those closures that Teresa mentioned and change the landscape of mental health. Now, not that system was the right system, but it really did change the landscape of what we see today, which is a broken system. So the next question I have for you all is, why is it not ideal to call the police in mental health emergencies? What effect does it have on the individual or the family, or both?
I would speak from my own experience. I'd speak from the experience of belonging to the African American community and communities of color, where typically the police has not had the best relationship with the African American community. I'm going to speak about the African American community. It is a community that has in many ways been over policed. The lack of resources that are available to the community, and I mean, the lack of trust that exists there. So if you have someone who is experiencing some mental health issues, and I'm going to speak from my own personal experience, I would not call the police because I would worry about what the outcome is going to be. And I'm not the only person that has had that type of experience. So I would be worried about what the outcome is going to be. I need them to be alive.
Yeah, I was in a conversation with the Eugene Police Chief, Chris Skinner, just a little while ago, today actually. And one of the things that really came up in that conversation was really the recognition that, you know, we send a lot of visual cues as first responders when we're showing up on a scene. There's a message that's sent before you even start to have that interaction. And with this, you know, really looking at who it is that we're sending out for these mental health emergencies, we need to really consider, you know, those visual cues and what they can do to prompt, you know, certain responses, what they can do to trigger somebody. And so with, you know, with police responding to these situations, that officer might have an amazing track record. They may be the most empathetic and compassionate listener, right? They may be entering to this, you know, and have the ability to respond in a way that's going to be therapeutic and trauma informed. But because they're coming with that uniform, they've got that radio on their shoulder, they're wearing a badge, they've got that tool belt, right? Those cues, those visual indicators of who the responder is in the situation can potentially trigger and escalate folks. And so, you know, with Chief Skinner today, what we were really talking about was that whenever possible, you know, by just having somebody who's wearing a different uniform and has a different set of responsibilities and authorities can do so much to de-escalate a situation before that interaction with the patient, you know, the person experiencing the crisis, has even really started.
Great points.
And we were kind of where Teresa was. My partner's son is Hispanic and our grandson was deaf, and both had significant mental health challenges. And so there was that fear that delayed our response, because we didn't know if what level of response to a young Hispanic male who was having a violent mental health episode would he get shot. And that caused delays in care. We weren't calling for intervention because we were too scared of him dying. By the time we were calling, it was for enforcement. And that's terrifying.
Absolutely. Other thoughts on this? They've asked me to ask myself a question on this. What effects does it have on officers, since most aren't trained for mental health crisis? And I'll go into that in a second, but it was actually really interesting for me today. Sometimes things happen at the opportune time to talk about. I just received a phone call just before this from a staff member here on campus whose coworker is definitely in a mental health crisis right now, contemplating suicide. And you know, I have some luxuries here. I actually have a mental health advocate embedded in the police department, and so it was a priority of mine when I came here in 2017. And we hired on Kinsey. She also has a therapy dog, Zosha. And so I was able to send Kinsey along with one of our plainclothes police officers who does mental health work, and they were able to respond out to that. But not every police department has adopted a model like that. And, you know, seeing more of that definitely takes some of that frustration away from officers, right? So the officers don't have that. Not everyone's best suited for mental health work. We all know that, right? And it takes all types of people to work in the police profession. But none of us know who's going to get called to that call at any given time. So we have invested a lot in training our officers, but you know, some departments haven't had that, and it's frustrating for the officers when they get to these calls, frankly, because sometimes there's not anything for us to do, right? Because there's not the resources that exist in our communities, like stabilization centers and others, and they get frustrated because we take people time and time again to the hospital and see them released a half hour later, and then we're called back to the scene because things have escalated. We're lucky here where I work, we also have a mobile crisis unit. Unfortunately, though, the officer has to be there for 45 minutes to an hour before a mobile crisis can get out. So there's that potential for an interaction to go differently. So, you know, a lot of officers are frustrated with the current situation. I don't think any of us are saying we're the best suited. Unfortunately, it's been thrust and thrown upon us that we're the responders because we've taken funding away from social services. We've taken funding away from those other areas. So I think law enforcement does, in most instances, want to be a help find the solution, or at least I do in my area, and want to help nationally. That's why I'm involved with groups like this. So my next question for all of you are, what alternatives are there, and what alternatives do we need? Give you a second, and whoever wants to go first.
I mean, you mentioned, co-response, and those mobile crisis teams. That is certainly one resource that's out there. And I think I'll go into some more, I think, on the differences between some of the different approaches a little bit later on. But in some of my work, really talking with other communities throughout the U.S. around, where their services are at, what they're trying to bring in. We see across the board really a need to ramp up mobile crisis, in communities throughout the U.S., regardless of how those communities want to see that mobile crisis response structured. There's a desire to really move us out of this space where we're obligating officers to be those first responders. So, there are a lot of different approaches that we've seen out there, having crisis workers in dispatch who can field calls, try to resolve over the phone, and then are able to dispatch teams. That way, there's the CAHOOTS program, which I'd be happy to talk about, and we'll check in with about, a little bit later on, that we have here in Eugene and Springfield and Oregon. But, ultimately, what we're really talking about, what alternative that we need is to have, there's somebody that you can call when your house is burglarized. There's a number that you call when you're having a heart attack, or when that house is on fire. But we don't yet have that first response for these behavioral health crises. For these situations related to addiction, mental health, and poverty. And when we're talking about alternatives, what we really need to be looking at is why we don't have first response for these, sets of issues. Why isn't there mental health first response in our communities?
Yeah, I remember when I first graduated with my master's degree, I started working at a Iowa Children's and Family Services place here, and we were working with the police as on their mobile crisis unit. And so our team, one of us was assigned every single day to ride with an officer, but one person doing that is not enough to respond to the kinds of things that are going on all over a community. It's like that needs to be much more basically available, as well as someone who is saying, you take them to the hospital and then they're released a half an hour later. You also need a place where people could be for a little bit, not just half an hour, and make that more fluid.
I would add in there, we don't only need trauma-informed responders and rapid responders. In Milwaukee, as Michael, I'm sure you're aware, you have things like the wraparound program, which is wonderful, but it can take them up to 45 minutes to get there. So we need the mobile, we need the crisis units, but we also need a variety of folks trained in responding to those of a variety of races, a variety of languages. It's not just primary response, it's so much more complicated than that. So it's speed, it's urgency, it's the emergency for mental health services, but it's also someone who's going to show up and not panic when the person doesn't speak your language, show up and have some racial awareness and be able to speak to the Hispanic community, to speak to the Middle Eastern community, to speak to the Black community without terrorizing.
I'd also like to add, and I support everything that Amy just mentioned, but I think even as we talk about, our communities, when we widen our scope, I think it is especially important that on the local level, on the national level, that we put people in office who are going to make sure that we have the services that we need in our communities. That, that should be on their platform. We should be demanding that these things are available to us. You can't do anything, without good mental health. You can't move forward in life without it. So it affects your ability to get along in life. So yes, we need, more services, but we also need our leaders to get on board and to support us in getting the resources and things that we need to bring to our communities.
Thank you. The next question is for Teresa or Amy or both. How do the interactions between race and mental illness play out in encounters with law enforcement?
All right. So you're asking how. I guess I just like to push back and say why, because we need to look at the history of, the history of how maybe, well, not maybe, how the history of race in America and how it has affected communities of color, particularly the African American community. Again, a community that has been over-policed. Again, a community that has not had the best relationship with police. But in the history of the country, where laws and things have been enacted to keep people from progressing, to minimize the rights of people, you have to ask why. You really need to look at it in the historical context. And then that's how you get to the how. But we have to recognize what the why is. That's how we got to where we are. That's exactly how we got to where we are. It's the why for me.
And the how is catastrophic for any community of color when it's our children. You know, when our son was 15 and 16, he was perceived by responding officers to be a grown man. Because he is Hispanic, because he has dark hair, and because he has brown skin, he was seen as a grown man, which means that when he and the younger boy were, smacking each other, they're 2 years apart in age, he was seized, choked, handcuffed, because he was seen as a grown man assaulting a child, rather than a 15-year-old smacking a 13-year-old who had just smacked him first. The boys were screwing around. And it escalated into a mental health crisis issue because from his perspective, his life was being threatened in that moment. He was just playing hard, the boys, but so it can be terrifying if you're part of a community of color or an alternate, in my grandson's case, deaf community. You don't know if you're going to die from the person coming to help you.
I appreciate both of you sharing. Teresa touched on the history of policing. That's been an important topic for me, of not the history that's taught, the actual history of policing. And I have 2 staff members who are dedicated to the effort of really getting out there, and we presented at the National Conference on Race and Ethnicity on the true history of policing. And I think first we have to acknowledge that history before we can even move forward and before we can even change that. And so that's been my push with my fellow law enforcement chiefs and leaders is we have to acknowledge that before we can reshape and move in the direction we need to move. Tim, I want to switch to you and go ahead and talk about, we have mobile crisis around our state. How does CAHOOTS model differ from mobile crisis?
Yeah, so I think it would be helpful to really maybe just briefly explain what CAHOOTS is and how we operate here within public safety in Eugene and Springfield here in Oregon. CAHOOTS, which is an acronym, it stands for Crisis Assistance Helping Out on the Streets, is an integrated healthcare approach to mobile crisis. We operate within public safety, which means that all of our calls for service are being dispatched through the PSAP. That's the same public safety answering point that you call for, fire, EMS, police. When you call 911 or the non-emergency line in Eugene and Springfield, you press 1 for police, 2 for fire and EMS, and 3 for CAHOOTS. our teams are out there, you know, responding to calls 24/7, and because we have an EMT as part of our response, you know, we're able to respond to a lot of situations that may not present initially as a behavioral health crisis, but where there is that intersectionality between physical and behavioral health. You know, I think how we differ is that by having that integrated healthcare approach, we're able to respond to a lot of situations that a more traditional mobile crisis team might not encounter, specifically around addiction. You know, there's such a dearth of resources in that regard. With our responses, we're handling, you know, gosh, what it is almost 1 in 5 of the calls that are coming through our public safety system are ending up with a CAHOOTS response. So, you know, I think first and foremost, we operate entirely within that first response sphere. You know, we're not waiting for a referral from an officer. We're not going out with more traditional systems like an officer, like an ambulance or a fire engine. By and large, we're able to handle these situations on our own. Because of how we're structured, we have a lot of privileges that other more traditional mobile crisis teams don't have. Like, we can do direct admits to the hospital. We're able to do direct admits for detox and sobering. And because we're not utilizing that co-response model, you know, we have a lot more freedom in where we're able to take folks. You know, we have a van, we can transport somebody free of charge with a voluntary and confidential intervention. And so if somebody's crisis is really about a lack of resources, we're able to get them connected to that shower and that hot meal. You know, we're able to come in when, you know, that you know, kind of rough housing, you know, escalates. You know, CAHOOTS teams are able to go in and have that intervention and de-escalate so that police aren't obligated to show up to that scene. You know, and I mean, I could go on for hours, you know, about, you know, the nuances of CAHOOTS services, but I think really the key takeaways that I want folks to really remember is that, you know, we're operating with that in that first response system. You know, we're not waiting for referrals from other infrastructure, other responders. We have an EMT paired with our crisis worker. And I think finally, for our crisis workers, we're not pursuing, you know, licensed clinical social workers. We're really trying to value that direct experience. And so you see that many of our response staff, you know, we have hundreds of hours of training in this response that we do, but our responders are oftentimes coming from that place of lived experience, either having, you know, walked that walk themselves or supported family and friends as they've gone through that journey in the past.
So quick follow-up on that. So how do you fund the program? How does
the program? Yeah, the program is funded mostly through city funds. So our city managers, our city councils, you know, approve our budget. We get some supplemental funding from a state grant, and then we also get some wraparound funding from Medicaid as well.
Oh, interesting, very interesting. Ellen, how did Let's Talk get started, and tell us more about restorative justice?
Okay, so as I mentioned earlier, I'm a member of AMOS, which is an organizing institution, and Let's Talk came out of our juvenile criminal justice research team, which was one of several concern groups. And the whole focus of that was to interrupt the school to prison pipeline for students of color. And so we saw ourselves as a volunteer group offering to provide mediation between students who were having conflicts. And we wanted to shift the system from punitive, where you're out of school for a week or whatever if you have a fight, to a restorative process where we would sit down with 2 students and they would have a chance to, the victim would have a chance to talk about the impact it had on them. The offender would have a chance to acknowledge and take responsibility for it and find ways to shift that issue. And so the idea of restorative justice is something we wanted to plant in the minds of school administrators and teachers as a mind shift from the more punitive model, because we know that it's been proven that teachers that use restorative discipline practices find that behavior in their classroom improves dramatically. And we saw some of that, experienced some kind of that dramatic shift a couple of years ago. One of the middle schools here in Des Moines that is over 50% students of color wanted us to come in 5 days a week from 11:30 in the morning until school was out, so that we had someone there all that time in a community room, which was basically a classroom not being used for classroom stuff. And students would come there and sit with that adult to talk out what was going on. And we also made sure that most of those days, the adult who was there was a Black adult, so that the student could identify with the person who was speaking to them. So the thing we learned at the end of the first semester was that the administrators noticed that there were many, many fewer referrals to the office as a result of this shift in how their mindset of how they were handling these students. And so that piece has been kind of the piece that the school system actually has started shifting gears to think about. We also help train staff at several different schools on how to do restorative circles, which is another basic restorative practices model that looks at things not as punishment, but as let's restore what's been happening and hear what people have, how people are thinking and feeling about this. So that's been the main focus, is it wasn't specifically about mental health, but of course it is a whole different impact for people with mental health issues. And you get a different way of seeing people look at you when you are not being told that you're a horrible, bad kid, but that you simply have an issue here to work out with someone else. So that's been the main piece. I mean, the basic issue around restorative processes are being heard and being able to take responsibility for what you've done and make amends for things. So that part has been just a focus for us now for 5-6 years.
Thank you. I'm always excited when I see restorative justice programs. My master's work was in restorative justice, and it's always exciting to see. It seems to be really slow still, but we are, even in higher education, starting to see it more in the disciplinary processes, and it's exciting to see moving towards a different way. The next question is for Teresa and Amy. What are the effects on the community when police are called in a mental health crisis? How does it impact families and peers with serious mental illness?
I guess for me, I think it's quite clear. We've seen in the news quite a bit, quite clearly what happens when these things occur, what those effects are for the person that is having the crisis, to not be understood or to not have the situation understood in a way that would be helpful and healthful for the person. It results a lot of times in their being locked up. So they're taken to prison or jail if not harmed in some other way. But the time that they have now, they've been sent to prison or they've been sent to jail, they've been sent through the system, they might end up in isolation. And as far as I know, I don't know that there are a bunch of mental health services available in the prisons for people. But what I do know is that the time that they've been, the time spent processing them, doing all these things could actually have been spent getting them the help that they need, the therapy, the medications, everything that is needed to make that person better. So I guess we already know what that looks like, and it's not a pretty picture. It hasn't been positive. And for the families that have to endure this and see this happen to their loved ones, it certainly creates a lack of trust, but also it's a grieving process. Nobody wants to go through that. Nobody wants to witness that. Nobody.
And each time another event happens, you know, I know we would go to other mothers with brown-skinned sons and say, oh, you know, my gosh, this happened. And rather than helping us to get him under control before it escalated and someone was harmed, they escalated it. And so we'd tell 6 other sets of parents, watch out, be careful. And so it sends those ripples of fear throughout the community, and it widens the gap each time as we try to protect our children.
And you know, a lot of that goes into, I call this out a lot, is the way we train law enforcement, the way we train first responders does play into that. And we need to recognize that. And because we right, no matter how we switch the model, there's going to be a time where a law enforcement officer potentially interacts with somebody in a mental health crisis, no matter how hard we try to switch this model. And so we have to change that training model and that perspective. A mobile crisis has existed in Polk County for I've been told 30 years. And so my question, and this can be, we can broaden this out to mobile crisis in general, but is it meeting the needs of people in crisis and their family members? And what do we need to improve? And anyone can, you know, answer into this one.
I will always believe that what we need to improve is we need to make sure that they get the funding that they need. Again, and I'll harp on this, we need to put people in office who are going to make sure that communities get the things that they need. So much of what we have available as far as social services could be improved. That's it. Funding is a key component. Now, it is not the silver bullet to address all the other systemic issues that we face, but funding is a pretty high priority, and that would certainly go a long way.
Yeah, the only reason that, you know, our mobile crisis services are successful is because of the connections to other services, the other resources that are in our community. And even with, you know, what looks at first glance to be, you know, a fairly robust system, I have 9,000 neighbors who are without shelter on a nightly basis. You know, we have guidance from the CDC saying not to sweep camps, you know, to empower folks to be able to shelter in place. We have our chief of police saying they're not going to sweep camps, but then there are workarounds that are discovered, and we see massive camp sweeps happening with minutes notice in the rain. You know, there are not enough beds. There are not enough resources out there to allow folks to meet those most basic human needs, which if given that opportunity would, you know, create a platform to address some of those greater issues, to be able to, you know, respond to, you know, the mental health diagnosis, to, you know, be able to find ways to, it just, yeah, it's just, there's just not enough out there, you know. And so Teresa's right, it's elected officials, it's you know, it's going to city council to say this is an issue, this needs to be a priority. And then when commitments are made as constituents, we need to hold those leaders accountable. You know, we need to be banging that drum and saying like, hey, you said you were going to do this thing. Where are those shelter beds? You know, you said there was going to be a crisis respite center. Where is it? There were going to be changes to camping ordinances. Where are those? You know, and going beyond that, even to really push for things like housing and addiction to be protected class because we see so much bias crime happening. But because these are areas where there isn't protected class, there's no ability to really, further enforce those crimes and to protect those who are at most risk of being affected by these issues.
Any other thoughts on that?
Just a very quick one. We need a cultural change. We have got to get the culture shifted in America away from this, I call a police officer for everything. We've got to kill the Karen culture, that culture that says it's all about the police.
And it literally is, they call for everything. I can confirm that. And we're have to train our dispatchers differently. That's a key component in that, of being able to suss out some of those calls, and asking those deeper questions about what is suspicious about this. Why do you need police? Is there a better avenue? Is there a better resource for it? I had the conversation last week with our general counsel and our mental health folks here on campus about, our crisis, we talked about mobile crisis. Ours, unfortunately, is we call them and then 45 minutes to an hour later they come. What can we pull some funding to make that so that they're embedded here and can respond right out instead of my police officers responding out? And making those shifts are really important for us. And we're right at time to switch to the questions, which I see there's been a lot of questions or potentially a lot of questions coming in. And I know we have a hard cutoff at 2:45.
Yes. So yeah, there's a lot of questions in the chat, and you actually kind of addressed one just now, Michael, about the training of dispatchers and when to reach out to another agency rather than law enforcement. And what you were just talking about actually leads in very well to a couple of comments that came through on the Q&A. And Leslie Carpenter, who I would encourage everybody to look up Leslie and the advocacy that she's been doing around mental health courts, especially if you didn't get a chance to see our breakout session on that earlier. But her comment was, the sad reality is that we have consistently cut mental health services, closed facilities, and then allowed medical facilities to turn people away with the most serious brain disorders. And then the police end up being the only public system who can't say no. And I would go as far as to say that that has been true for communities of color even before those cuts to the mental health services took place. And that is something that's incumbent on the rest of us to understand. And also with the comment that came in after that, that of course, most people call the police as a last resort and as a means of keeping the person with mental health issues safe and the family or people involved because we don't know who else to call. And I also want to point out there that that is definitely that's a decision within a family. And I don't think that anyone here is saying that you have another better choice in some of those situations, especially in rural areas. But what is being said here is that that is not a good option for a lot of communities. And and it's coming to light now more because it is affecting more white people. And that should not be the case. We should care about it whether it affects us or not. But that's, certainly a decision within a family. And for a family in a community of color, they would reach a different conclusion than I would necessarily in that situation. So I thank you all for talking about those systemic inequities involved there. I just wanted to address that because for those who have been through it, it's not your job to tell us to do that emotional labor and tell us what that was like to experience it. It's up to us to try to educate ourselves about what that's like and what that experience is. So I did, there's maybe Michael, you can speak to this one actually. What is the role that law enforcement plays within the Iowa mental health system, whether it's inpatient, psychiatric units, ER, et cetera? And is there data on police interactions related to that?
Those are great questions. Our role's really been, well, our jails are the largest mental health hospitals in the state, unfortunately, with very limited capabilities to handle the folks that they're seeing come into the system. We tend to just get called when the crisis happens, right? And there is no statistical, central repository of data of what police are responding to and in our state. There's not a good collection mechanism. One of the things I've really started tracking with our department is how many mental health well-being checks are we going on and how many are we having? And maybe if you look at how many you have, is there some budget that could be rediverted and you don't need those same resources? You can redistribute resources is really important to me right now. But right now, that might be something for our elected officials to look at, right? How do we collect data? There isn't really a central place to collect much data when it comes to the activities of law enforcement statewide.
Mm-hmm. And I would just ask, in some of the instances that you may have been a part of, those who are involved in kind of a community response, off the top of your head, if somebody is wanting to, reserve law enforcement for absolute last resort, what are some of the things that you would do? What are some different providers or community groups or even like friend groups that you would call upon to handle that?
I can speak for what we have here in Oregon. Really looking at the recognition that socioeconomic factors play in a lot of crises. We see a lot of folks really utilizing the mutual aid network that has been established in our county as a result of the pandemic. Additionally, street medicine, harm reduction organizations, those groups that are really going out there and trying to resolve, really address the needs that are going unmet. Beyond that, though, talking about what can we do as individuals in the community, first thing is to get to know your neighbors. I know it's kind of hard right now, but put that mask on, speak a little louder, stand a little further apart. But neighbors aren't just the folks that are paying rent or who are paying property taxes next door to you. The neighbors are everybody, in your community. And that means that you have to get outside your comfort zone a little bit, but, don't avoid eye contact. Actually, acknowledge, the folks who are forced to exist without those four walls and a roof. Get to know them, and that allows you to say hey, I see that Z is having a hard day, and I can go, Z, do you want me to call Whitebird for you? And say hey, I don't want to get in the middle of your camp. I'm not trying to tell you what you can and can't do, but I see you, every day. I care about you. You live on my block. Do you need anything today? It's going out and actually lending some support. It doesn't have to be money. It doesn't have to be a lot of time, but it could be sharing those posts on social media, making sure that folks are aware of the resources that are in the community. If you go to church, going to those, going to your congregation and saying, hey, we got to do something, but really engage with your neighbors, engage with your community. If you see a need and there's not a resource out there and you have the energy to respond, get something going yourself.
And Tim, I think that's where technology has killed us, and people getting to know their neighbors like used to be. I remember as a kid, my family knew everybody's family in the neighborhood, and those days have been lost.
Yeah, and there was a similar question a little bit further down about accessing mental health care without the police. And unfortunately, our society is set up to, kind of have gatekeepers for all of this information. But there are things that the community can do. Are there any particular trainings that you would recommend for just general folks in the community who are interested? And I guess that that goes to anybody, but particularly Tim, maybe you know of some that community members can get involved in.
One of the things that I've seen really help empower folks to discuss these issues and to talk about crisis response and behavioral health issues is to engage in trainings like mental health first aid. The opportunity to really learn, gain some understanding. But beyond that, not enough folks are going out and getting Narcan training. We are, in addition to all of the other epidemics that we're facing, around racism or around, opioids is one of those things too that we need to really recognize. And I carry Narcan in my glove box. My wife keeps one in her purse, and that's because we feel an obligation to our community to respond when we see something happen, right? A lot of us go and get CPR training, get first aid training, so that we can be there when someone's choking on lunch or, stops breathing, whatever. But there's this fear, and I think a lot of it is attached to both white fragility and the morality that we place on addiction, that if more folks were just carrying Narcan, fewer folks would be dying from opioid overdose. Other than that, find something that you're passionate about, that intersects with this work, and go out and learn more. It doesn't have to be formalized training. It could just be reading. It could be watching. There's a series on YouTube, Uncomfortable Conversations with a Black Man, that personally for me have been really helpful in taking these things that are very theoretical and finding the vocabulary to discuss them in ways that feel accessible to folks who are coming with different educational backgrounds too. So get outside your comfort zone and learn whatever that specific training is.
I also, you made me think of something along those lines, speaking of finding things that you're passionate about. I actually want to, if Teresa's willing, to talk about her project, Stories to Tell My Daughter, because I've attended that, and the stories that you hear and how people handled their situations, whatever the story is about, are completely inspiring. So I'd like to, Teresa, would you be willing to talk a little bit about that? You're muted.
Self muted. Okay. So Stories to Tell My Daughter is the storytelling event, although I've taken the calling of the storytelling experience that I do. And we actually would have done one in March, but good old COVID showed up and kind of derailed plans. But the point of it was started to give Black women and women of color in my community a voice and a way to share their stories and to uplift their lived experiences. And doing Stories to Tell My Daughter, a lot comes out about how people navigate hard times in their lives. What I've never actually probably publicly said, and I'll just say it here, one of the main reasons why I wanted to do it, because I saw it really as a way of doing mental health without actually telling people that that's what you're doing. So being able to share your story, being able to have people bear witness to a situation that you've gone through, is a way to allow the community to rally around a person. It's a way to create empathy, so our shared experiences. I don't know who might be sitting out in the audience. We don't know how that story is going to affect them, how that's going to speak to them. But one thing that I have found, and what I do know about storytelling, is that it allows people to walk in your shoes. Sometimes it allows them to walk with you. And in terms of decreasing racial barriers, it allows you to see the person's very similar to you, for you to know that they're really no different than you are. So it's a lot about creating empathy and being able to kind of stand in the gaps for somebody else and bear witness, because being able to bear witness is a pretty powerful position to be in. And you're more likely to help the person. So I don't really know if that answered your question.
It did. It was really good. And I would say too that there's, you know, there's lots of organizations who are kind of starting to do some of that. And I see it as, you know, very similar to, we have a program at NAMI called In Our Own Voice. And, you know, working with folks who may not be used to telling their story, especially to a group of people or an audience, but they can learn to do that. And that you're right, it allows people to walk with you and experience what it's like in your shoes for that. I'm gonna take a different turn now, just because I saw a question pop up that is very interesting and I think very important in the just really couple minutes that we have left. This one comes from someone who works in a prison and says that, of course, incarcerated people are often punished with solitary confinement when they experience mental health crises. Is there anywhere where this happens, or is it a possibility for a mobile crisis unit to go into the prison? Do they have something similar in some places? Or are there other ideas for crisis intervention in prisons? I don't know if anybody has direct experience with that or knows of programs around the country. I will say that we did receive a lot more questions than we probably have time to answer. So I do want to put out there that if your question did not get answered and it's a burning question, please feel free to reach us at NAMI. We're at 515-254-0417 or info@namiiowa.org. If we don't know an answer to something, we try to connect you with the best person to answer that question. So this may be one of those as well. I do know that we at NAMI Iowa have been in talks with the Department of Corrections in Iowa to do some provider training with corrections officers and clinicians, as well as there are some peer programs in most of the correctional facilities within Iowa. So we're one of the first states to do that. I want to give just a little bit of time for you to wrap it up, but I will save all these questions and see if I can get them answered. And if you follow the NAMI Iowa website, we'll see if we can get something up there.
And Heather, I can help with that. Just if we can get me the questions, and then I could try to work with some of these folks to try and get some of the answers. Happy to do that. Is there any, this is a great panel. I appreciate you all. You answered a lot of questions, I know, for folks today. A lot more out there. Is there any burning thoughts that you have that you want to part on us as we call it a day? All right, well, hearing none, I will, a round of applause for this great group, the virtual applause, right? Thank you for everything that you're doing in your communities. We really appreciate it.